So I want to take us into the last piece, which is our motivational interviewing practice. So if you all open up your folders, there are 2 handouts and I want to walk you through them. I think it's on the PowerPoint side.
It's on the right side.
Yeah. So there are 2 things that say BNI steps. So the short spiel on this was a motivational interviewing tool. So it looks like this. It has like little bullets and little pictures on it, and there are 2 versions. So I want you to pull those out.
Scales on both of them.
Yeah. So the program I worked for in Boston had a partnership with the Boston University School of Public Health, and they developed this flow to do brief substance abuse screening and intervention in the emergency room. Because what they found was, I think it was something like 60% of the folks that were in the emergency room, alcohol, drugs, or cigarettes were in some way involved in what landed them there. So they're like, this is a perfect opportunity to do some assessment and some basic behavior change conversation and referral in the emergency room. So there's a tool called the brief negotiated interview that is designed to take between 10 and 15 minutes, and you can do it with someone a new client. It doesn't require a long relational history to be able to pull it off. So that's a whole training, and it's a great training. But what this is so our team took the brief negotiated interview that we have used with clients and adapted it as a flow to use with staff. So the demo that you saw me do with Amy was a version, the supervisor number 3 was a version of this flow. And again, I think when I first saw, if they call it an algorithm, I'm like, really? Do I need an algorithm to tell me how to talk to my staff? Like, step 2, I'm gonna ask this open question. Like, I was a little irritated by it. But the thing is, it works. And it's really, once you get a handle on it, really intuitive and very useful. So I often do pieces of this. I don't do the whole flow in order. And for those of you who know motivational interviewing, this is not rocket science. Like it's basically just a little guideline for how to talk through different kinds of challenges with staff. So the idea with this is it's collaborative. It's focused on finding strength and internal motivation in the staff person that you're working with. It is structured and meant to be practical, and the end of this this interview is a SMART goal setting on the behalf of the staff person. So for example, if I'm chronically late with my documentation, we would use the version that says for staff behavior. So it says version 2. So I'll walk you through the steps here if you all can just follow along with me. So a typical work day is your assessment piece. So, how have things been going? What have the last few weeks been like in your work? So this is something you would do during a regular supervision meeting, either, bi-weekly or monthly, however often you meet with folks. And this is meant to be done one-on-one. So, and then it's the asking permission. So would it be okay to talk with you about your late documentation? And so let's say the person says yes. So you want to find out, what's working about how they're handling doing their documentation now. And they might say, because I'm not fussing so much about documentation, I'm seeing all my patients and I'm really involved in them getting the care they need and feeling really good about how that's going. Like, okay, what else is good about how you're handling your documentation now? And they might say, I used to be here way more hours than I'm getting paid for, and now I'm leaving at the end of the day and not working extra time, and I feel good about that. Okay, that's good too. So you keep asking, what else is good about how you're handling the problem behavior? And you can put any problem behavior you want in there, and you want to ask in a neutral way if you can. So you summarize that. And then asking, what are the not so good things? And I have a staff person who we've had this conversation over the last 4.5 years, probably like maybe 3 times a year. And it's like our regular thing. And so I'll say to him, what's not so good about how you're handling your documentation? And he's like, I'm on, verbal warning. I feel really anxious. I'm avoiding coming into the office because I know that I'm in trouble. Like, I feel like really worried that I'm going to lose my job. And so there's a whole host of consequences that come from not doing what he knows is his responsibility and his role. So we talk about that, and I summarize that. So what that looks like is, on the one hand, this is what's good about how you're handling your documentation, and then here's the downside, so where does that leave us? And usually the person will say, well, you know, I think I need to do something different. And so, before we do that, the third, so I just did pros and cons, that's number 2. Number 3 is sharing information. So for something like documentation, sharing it, usually it's neutral and it's brief. So it's something like, you know that if your documentation is late, it puts our funding in jeopardy. So it puts our grant funding in jeopardy, or, you know, we don't get paid if we're not documenting the work that we're doing in a timely and accurate way, and that not only impacts you and your patients, but also the rest of our team. So you can sort of, to me, that's the section where you talk about what the effect of the behavior is. So with Amy, it's like, okay, well, you're creating problematic relationships with your team and confusion with other departments, so that we can sort of frame it more broadly. So then we get to change readiness, and the question that I ask it is usually, so on a scale of 1 to 10, with 1 being, I don't want to change a thing, and 10 being like, I'm on the bandwagon, what number would you give yourself? So somebody might say, I give myself a 5. So it's like, oh, good, that means you're halfway ready to be making a change. You know, why did you say 5 and not a 2? And the person might say, because I really like my job and the documentation is the part I hate and I don't really want to go work somewhere else. Or I know even if I lost this job, it's like I'd have to learn how to do documentation if I went to another place. Or I know I suck at time management and I really want to get better at it because it's a problem in my personal life too. Whatever the reasons are. But you're trying to elicit reasons that the person has some motivation to change. Okay? And there are some more open questions you can ask in here. So including, like, have you had success in the past? These are sort of the standard motivational interviewing, uncovering resources questions. And then you do the goal setting. So it might be, between now and our next supervision next month, what specifically can you commit to around dealing with your documentation differently? And the person might say, I'm going to come in to the office early one morning a week and spend an hour alone doing my data entry. Or I'm going to not take any new clients this month and I'm going to get completely caught up on my documentation. Or I need you to send me a text reminder every Monday about when my stuff is due that week and then come and check it, because I won't do it if you don't check. I've done all kinds of things with people depending on what they need to get done, what needs to be done. And again, the question of how far you go is another conversation, but that's the idea, is that you're not fixing the problem, you're eliciting their input and setting a specific goal to solve the problem. So that is version 2. Comments or questions about any of this? So I've used this to talk about boundary crossing, I've used it to talk about lateness, about documentation, about what I would call maybe not the best collaborative behavior towards other people on the team. What else?
I have a question. I think Ona brought this up maybe earlier, someone else did, but what if the staff that you supervise is really well trained in MI, and so you could just acknowledge that you're using this. Is that the best thing, so they don't call you out on it? And I haven't supervised yet, so it's not like I'm gonna do that. But yeah.
I sometimes just say, I'm gonna have an MI moment with you.
Yeah, okay. So I should just, because I don't want them to, I guess we've talked about that, just be transparent. Because they're gonna know that I'm doing this. Like the scale of 1 to 10, where they're all trained in this.
Right.
Okay.
And you can also say, how does it feel to be on the receiving end of motivational interviewing? Like, is this comfortable? Is it uncomfortable?
Right.
I would agree with you.
They know it works.
It's a subtle thing where someone can feel patronized, right? Who knows what it is.
Right.
It's like a tiny, tiny change in your tone, or like one different word that you use between brilliance and feeling like you want to throw something at that person.
Yeah.
So I think, again, right, it's another tool. It's maybe there's certain stuff you don't use it with, you acknowledge it, or you say whatever. I think that you have to be real with that person, otherwise all bets are off, and it's probably different person to person.
And you make an excellent point about all of it. Motivational interviewing is, while you say your staff may notice it more, the success of motivational interviewing is having that genuine curiosity with any client too.
Right.
So channeling genuine curiosity and spirit is
Right.
what's going to make it real.
Sometimes I think of this as kind of, it's like talking points, you're sort of learning the basic shell, but then as you get better and better at it,
It gets integrated.
like you're using your own language, and there's other, there's other ways you might do it. This is just like a way to start, kind of, right?
Yep. So I want to walk you through, the other one is almost the same, but I think when you're first learning it, it's helpful to have another version. So the other kinds of stuff that I address most often with staff is there's something about how they're working with patients that I'm not happy with. So too much time, not enough time, boundary crossing, cultural incompetence, a family made a complaint about a worker, anything that's really about patient care, not making the appropriate referrals. I often will, like I've had clients fire staff when they're home visitor, and I'm always trying to suss out, well, is that about the client or is it something about how the worker approached them? So this is a nice way to go about that. So it's almost the same, except you're keeping it on the client and not the behavior. So tell me a little bit about your work with such and such a client. What's a typical visit like with them in the clinic or in their home? And then help me understand what are some good things about how you're working with this client. And then what are some less good things? So they may say, I'm really connected with this client, and I feel like, she's doing a really good job of coming into the clinic, but the not so good thing is she calls me every day. And if I'm with another client, she'll call me and call me and call me until she gets me on the phone and it's taking up way too much of my time. And so we're like, okay. So on the one hand, she's really engaged and she's making progress with her health. On the other hand, it's taking up a lot of your time and creating anxiety for you in managing your other folks, right? So for something like that, the sharing information, I might just do a little psychoeducation about boundaries, right? It's like, all right, this sounds like a boundary situation to me in a time where the client has pushed your boundaries, and it's, can we talk together a little bit about how you can set boundaries with this client in a way that would feel more sustainable and more okay for you, that will still keep her engaged. So then again, how ready are you between 1 and 10 to try a new strategy with this client? Same thing, why'd you say 6 and not 2? And then, what would a different strategy look like? And you can sort of explore that together. So, what have you tried? What haven't you tried that you want to try? How could you go about this differently? What have you seen other colleagues do that you might want to emulate? So very similar, just focused on patient care as opposed to staff behavior. Comments or questions about any of this before I give you a chance to try it? Okay. So what I would like for us to do with our remaining time is we're going to do Parish Practice. So I'd like you to pair up, ideally with someone that you don't work with, somebody different. So, and if there's an odd number, one of you can be with either me or Carla. And so I want you to think about a real supervisee. And you can decide whether talking about working with a patient issue or a staff behavior, which comes to mind in terms of being more useful right now. So can everybody think of somebody they supervise that there's a behavior change issue that you might like to work on?
No.
Yeah, we're good.
Okay, good. So, so I think so pair up with someone that you don't work with. So, I apologize for the time constraints. The practice, I think, usually takes longer than one might think. So I would just love to hear questions, comments for folks. How was that to practice? Anything you learned or anything that is sort of a lingering question that would be helpful to have answered before we finish up for the day?
I learned, it was really good, she said, why don't you think about some strategies that you can bring to this problem, and we'll meet again next week. Now usually I think I can't leave the room until we have those strategies, but that was really good, like, oh, I will think about that.
Because I think the temptation intention is to jump in and solve the problem if the person doesn't immediately know, but the idea that, you know, this is a longitudinal relationship, and so it doesn't have to get solved right now. Very good.
We actually did a who's an introvert, who's an extrovert, and how you process information is very different. And I have a whole staff of introverts, myself included. And so you can't
need
really
some space and
expect
time.
people to, jump right on. So that was a really good, I'm gonna try that.
Yay, good. Other people, learnings or lingering questions that would be helpful to address? How did that go? Did it feel natural? Was it uncomfortable?
I can say no.
Good.
I think once it was explained to me to follow these steps, it became more comfortable.
So you could kind of get into the flow step by
Then I
step.
could get into the flow.
Great.
Yeah,
Great.
thanks.
Yeah. Go ahead.
I was going to say, just using the 1 to 10, or 0 to 10 scale was a little uncomfortable for me, considering I was using it with the staff member.
Mm-hmm.
But she had some great insight on, just kind of turning around and saying, you know what, we ask patients this, or our clients this, so I want to kind of get an idea of where you're at. And that was really helpful to kind of, break it down like that, rather than just throwing it into the conversation. Well, give me, you know what I mean?
Totally. Well, because I mean, really, we're not doing something that staff don't understand. They're just not used to it being on the other side of it, right?
Yeah.
Good, good, good. Anything else folks want to say before we sort of wrap this piece up? So you have both versions. You can feel free to use them, to use pieces of them. I think for each of us, some of it feels more natural than others, but I encourage you, if you're a little like, I like it, but I don't feel confident, we usually do a full day of MI supervision. So practice with somebody else. If you have a peer colleague that you feel comfortable with, if you do it a few times, it will sort of sink into your brain. And I also, again, will just own it with staff. I'm like, I'm learning something, I want to practice with you, like, tell me what you think. And sometimes they're like, I hated that. And sometimes they're like, that was really helpful. So, it's learning process, and modeling that, I think, is a good thing too.